So that was our segue into impulse control disorders. So pathological gambling is a common thing that we see from dopamine agonists. People with Parkinson's often will develop these when you put them on certain medications. So some people can get very excited and interested in gambling. And especially nowadays with online gambling, you don't even have to go somewhere to do it. So this can be a problem when people can start losing a lot of money. But the impulse control disorders are not limited to just gambling. It's usually something that's sort of exciting or that is almost risk-taking. So we see like excessive shopping, binge eating. We see a lot of hypersexuality, both in men and in women. Punding is a condition where people do things just for no reason at all that offers no value to them or not. I have a patient who, from the dopamine agonists I put him on, he suddenly decided he was going to build a fence around his house, which was fine. So he every day would wake up and go and start working on the fence and would build, about 100 feet of fence. And then he would tear it down before he went to bed, and he'd wake up in the morning and do it again. He got no pleasure from it. He got no pain from it. He would just do it. And it's just an odd behavior, but it can be a side effect of the dopamine agonists. So again, the take home here is if you're on one of these medicines and you're noticing these things, let us know, because there are things that can be done. I mean, we don't always have to stop the dopamine agonist if someone starts, compulsively gambling. Sometimes we can use a medication to block that side effect, and you can continue on it. But again, it just depends on how helpful the medicines are for you. But definitely bring these to our attention, because they can be dangerous. They can wreck marriages. A lot of things can happen.